and it's more of you than not. Maybe I think Gabrielle and I are maybe the only ones who are not social workers. So I'm just going to start.
I'm not a social worker.
Welcome, everybody who has joined us. People are going to be trickling in. We had quite a registration. My name is Tiff Bluemle, and I am running for state rep in Chittenden 6-5. Gabrielle Stebbins, who is waving, is running from the same district, 4 houses from me. And we started these Zoom cafes because we really wanted to talk with people in the district and with field experts about some issues that came up again and again in conversations with people when we were walking through various neighborhoods this summer. And so this one is on mental health, which did come up again and again. And we want to try to keep this tight because we want to really allow the panelists to talk. And for folks who are tuning in to answer questions. The structure, it's an hour. We'll keep it to an hour. There are 4 great panelists that I'd just like to draw attention to right now. One is fellow state rep candidate from Essex, Tanya Vyhovsky. She lives in Chittenden 8-1. Umesh Acharya, Christina Pasnick, and Gabe Brunelle. And Tanya pulled this particular group of panelists together, thinking that they could represent different points of view in describing the landscape, the mental health landscape, and different populations. And so I'm going to just tell you quickly about the structure. Each of the panelists is going to introduce themselves briefly and kind of how they read the landscape, what they're encountering, what they're seeing in the field. Then secondly, as a group, they're going to discuss kind of where do we go from here? What are the solutions? What do, or really what are the questions that we should be asking? And then we will make sure that we save a full 20 minutes for back and forth discussion. Everybody's gotten the questions that you submitted, if you did. So they'll probably, some will incorporate that in, that into their introductions. And we're going to follow this up with some resources and with a tiny poll just to get your feedback about this. So thank you all for coming. And I'm going to turn it over now to Tanya.
Thank you so much, Tiff. I'm really glad to be here. So I'm Tanya Vyhovsky, and I am running for state representative in Chittenden 8-1, which is Essex, the town outside the village. And I am also a social worker, and I work, I split my time. I have a small private practice in Essex where I work with youth, teenagers and young adults primarily. And I also work as a school social worker in a K-8 school. So I work with a lot of different populations, different ages and in different settings. And one of the things that actually really made me decide I wanted to run for office is some of the gaps that I kept seeing in our systems. I often am working with people in my office or families within the community. And what I have discovered is many of them are struggling with systemic failures, and it started to feel a little bit irresponsible to continue to sort of patch people up and say, okay, go back out there, but the world actually still isn't really built to work for you. And so it's one of the things that drove me in 2018 to take the tools and the skills and the knowledge that I had actually to run for state representative to try and shore up some of those systems and really try to work to build systems that really allow all of our community members and all of our communities to thrive and not simply survive. So that's really what brings me to this conversation. And it's actually what brings me to wanting to be in elected office. And some of the things that I see that we have in my work in the schools and in my work in my private practice, that we have a lot of wonderful practitioners, wonderful teachers, wonderful people. But again, it always sort of circled back to these systems issues. And these systems are intersectional. And I believe that our solutions must also be intersectional. We can't patch a Band-Aid over here and expect it to solve these broader systems issues. And so I think it's going to take some real innovation. And I'm really, really excited to get a chance to talk to people from different parts of the mental health world and to connect, with Tiff and with Gabrielle to really start to think about, like, how do we work together and really build systems that lift our communities up and welcome people to be full welcomed members in our communities. So working with youth, I mean, I got up this morning and I had 10 referrals in my email, and I can't possibly take them. And many of those those referrals are, you're the 6th, 7th, 8th person I've reached out to. Nobody has openings. And in my school job just this week, I sent emails out to about 10 people saying, hey, are you working with young kids? And given the landscape right now with everything being on Zoom, most of them said, no, I'm not taking anybody under 10 or anybody under 9 because I can't make the connections on Zoom. So we knew that there were gaps in our system before this pandemic, and this pandemic has made them that much worse and really exposed gaps that we didn't even know existed. I work with a lot of individuals that aren't just struggling in one area, and it's multiple areas. And we know, when we think about Maslow's hierarchy of needs, if we don't have our basic needs met, it's hard to sort of meet the next needs. And so I know that we've got work to do, but I love that people are willing to come together and have these kinds of community conversations so that we can really start to do that work and really start to build towards a mental health system that is holistic, that is truly trauma informed. And I don't just mean individual trauma, but some of the larger traumas, the trauma of racial injustice and the trauma of economic injustice, and really try to think about innovative ways that we do that work. Before I went to graduate school, I also developed the Vermont Support Line, which was under the Mental Health Transformation Grant and was in conjunction with state government. And it was an innovative service. It didn't exist. There were a couple other services like it around the world, but I did worldwide research and built something in Vermont to meet an unmet need. And I think that we really can make this happen. And so thanks for having me.
So next up, we have Umesh. And Umesh, you can then pass the torch to Christina, and Christina, you get to pass the torch to Gabe, just so we keep the time tight. Right. Umesh, thank you. And thank you, Tanya.
Thanks, Gabrielle. I don't know what to say after hearing Tanya. She covered it really well. So my name is Umesh. I'm a certified youth mental health first aid trainer. I do a bunch of workshop, professional development opportunities for adults who work with youth all around the states on social emotional learning, resilience building, youth mental health. And one of the biggest part is I also provide information on the neuroscience. And what I mean by neuroscience is talking about neuroscience, adverse childhood experiences, epigenetics, and the resilience, science of resilience when I talk about the mental health. And Tanya covered really well about the systemic issues. But again, when I talk about mental health, I really think it's important to think about the overall well-being of an individual, right? It's social well-being, it's the economic well-being, it's the sound housing, like whether or not people have sound housing. So it covers a wide array of issues that a person is facing, because again, just like the basic needs, without those needs being met, we will not be able to talk about the needs that are higher up in that pyramid. Based on the culture also, I think the definition of mental health varies. And just by listening to me, you can tell that I was not born and I didn't grow up here. So I came in Vermont in 2012, and I call this place my home. The fact that I call this place home, I feel like I am responsible to contribute towards the well-being of this community. And that's the reason why I am here, because I feel like it's my home and I need to do something for the community. And, before I even get started with the problems and what I hear from the community, I think it's really important for me to say it out loud that the way we look at mental health is so Western culture centric. It fails to capture the whole picture of people from different cultures. Like, we don't talk about resistance as the mode of healing, and we talk so much about trauma-informed care, but what about healing-centric practices, right? Can we talk about healing-centric practices as well? Because we are more than just the trauma that we endured, right? And then when it comes down to other issues about like systemic racism and intergenerational poverty, those are all covered in the epigenetic section. Even though your DNA is not being modified, the systemic oppression that the people, marginalized group of people face today will be passed on to the future generations. So when we talk about all these mental health issues that are being faced by our youth, we need to be talking about the issues that their parents and grandparents face, because it's going to be passed on to the future generation. And that adds the urgency to act now, because without us acting right now, it will be impossible for us to end this cycle of intergenerational trauma, systemic oppression, systemic injustices, and even the intergenerational poverty, right? That being said, even for those who, and for people from my community, the fact that it is so Western-centric, people don't feel welcome to go seek mental health services, right? And there's a stigma associated with seeking mental health services. And even for those who want to seek mental health services, there is the lack of culturally and linguistically appropriate services. And I think most of you have probably seen the report from the Racial Equity Task Force. You know, it was, I think it was provided, it came out 2 days or 3 days ago. And they talk about how the total population proportion of the younger generation BIPOC community is growing day by day. And if we fail to seek culturally and linguistically appropriate mental health services, then we will fail this generation. And we know this mental health crisis, this mental health problem, challenges existed pre-COVID and will exist post-COVID. But the presence of COVID intensified or amplified the challenges that we face. Just like Tanya said, right? We don't want to take any 9 or 10-year-old because I don't feel like I can make meaningful connection with them. And that's right. But the fact that you're hearing means they're seeking help. And for lots of kids, lots of youths, home is not the safe place. And we are failing to reach to those youth who cannot report or who cannot talk about their challenges because they don't feel safe from home to talk about their mental health challenges. And that's where I feel like people like us who care about our community, who care about our youth, who care about bringing some systemic change so we can reach out to people who needs to be reached out, can be reached. That being said, I think that's all I wanted to say. I'm going to pass this to Christina.
Hi, everybody. Thanks to Umesh and Tanya. There's so much that you just covered that I hope to expand on and echo in what I'm going to say today. So I'm a licensed clinical social worker, and I work with a K-5 population currently. But I have worked with kids ages 5 to 18 over the years, and I've worked in schools locally over the past 6 years. Previously out of state, I've also worked in residential settings with both kids and adults with various mental health and developmental needs. I'm also pretty familiar with the child protection system in Vermont through my work. So where to start? We talked a little bit, Umesh and Tanya, I think, both referred to the hierarchy of needs. And I certainly see every day in my work that, you know, I work with kids on teaching techniques to manage anxiety and to develop their self-expression and identity building skills. And parents, similarly, we work on some of the same things and we talk about how they can support their kids. But at the end of the day, if a parent is experiencing a medical difficulty that they can't get addressed, and they're wondering if the lights are going to get shut off again, and you know, they've lost their job because of all of the closures with COVID. A lot of those things are really coming front and center, and it's going to be really extra hard to support their kids emotionally when there are all these other dire needs, putting food on the table and, you know, just getting the bills paid. So I'm really happy that we're having this conversation today. to talk about what we can do about some of those things. I think in some of the questions that we got, there were questions about wait lists, and Tanya also talked about, hearing over and over again, like 10 referrals she got this morning. I hear that too from parents in the community. They're looking for support for kids and for themselves even. And wait lists just seem to be really, really long everywhere. And that was true before COVID. I don't want to make it sound like this is a post-COVID issue, because we've had long wait lists for programs, both medical and mental health related, prior to the COVID crisis. As far as like wait times in the ER, I think those have always been long, or I can't say always, but at least as long as I've been in this community the past few years, I've known them to be pretty long, and that's still the case now. I think I'm really glad that I'm here to be able to talk about these things, and I can take more questions as they come in, specifically to speak to what's happening in schools and with kids right now. So I'm going to pass it along to Gabe.
Thank you. I'm Gabe. I'm a social worker. I don't have my MSW like my colleagues here, but I have my BSW. I currently work in a 5-day residential detox center for people to come in and safely detox from different substances, mainly alcohol, but we detox people from opiates all the time. We do use medication usually to help mitigate the withdrawal symptoms and to keep people safe in terms of not having a seizure, keeping their blood pressure low, things like that. What I'm seeing now is pretty covered by COVID. But like someone else was saying, I mean, I'm seeing a lot of the same problems that I've seen since I've been working there for 2.5 years. So the majority of the people that I work with are living in poverty. The majority of them do not have housing. And what I'm seeing is, in terms of COVID, I'm seeing people come in more often and more frequently. So since COVID, somebody will come in and detox, and maybe pre-COVID, it would be 6 or 8 months before I saw them again, if ever. During COVID, people are coming back sometimes 2 or 3 weeks apart to detox again. So I think, and I also think people are more isolated with COVID for safety reasons. And so I think addiction lends itself to a lack of connection and isolation anyway. I'm seeing that amplified by COVID, or I'm seeing people that are stuck in a small space with connections that are not healthy. And I think in terms of what's working well, I think that our services work. I just see people not being able to get connected to them for various reasons. I think housing is the biggest issue that I see. So I see people, they come in and they detox, and they don't have the resources to change their situations once they leave my program. Now, we do aftercare for people who want it, connecting them with other services, residential rehabs, intensive outpatient programs. And I see people going to those residential programs, and when they get back from those, they're back to living in poverty, in homelessness. So I know, like, things that we could be doing for the future. I know that we just got a massive stimulus package with a high dollar amount per capita in terms of Vermont's population, and I know that we desperately need affordable housing. And when I say affordable, I mean we need to house people that have no income, that need a safe place to stay sober, to treat their other mental health conditions that are happening, and to find employment. So in terms of affordable housing, I'm thinking like subsidized housing, safe housing for people that have no income in the beginning. And so I'm not sure exactly how all of our stimulus money got spent, but I'm hoping that a fair amount of it goes to like real effective housing. So, yeah.
Thank you, everyone. So I'll tee this up with the four panelists. First of all, thank you all for the work that you do. And thank you for taking an hour to talk here. I'll tee up, and Tiff and I are going to sort of tag team this, and folks are welcome to enter in questions into the Zoom group chat or confidentially if you prefer. But I'll tee up, you know, Gabe, you just said the services are working. And there's a part of this conversation that is about capacity. So it's not necessarily whether or not the services are working, but whether or not we have enough for the services. And whether or not, you know, there were several questions that were sent in to us earlier about, would we have as many issues with policing? Would we have as many issues with you know, criminal justice reform if we, or domestic violence or drug abuse, if we had, if we were able to catch people and help them before it became an acute crisis. And so I just want to, I want to throw out there, Gabe was, thank you for highlighting what's working, because this is a hard conversation. And I would also like to highlight that last night when we talked about this discussion, Tanya said, what she's been thinking about is that public safety is having everyone's needs met. And so I might pass the torch now to Tanya to talk a little bit about what are the other things that are working, because it'd be great to talk a little bit about the positive, and then about what's not working, and then about what what elected officials can do and what listeners can do.
Yeah, absolutely. Thanks, Gabrielle. There's a lot that's working. And, you know, I think that the many people that go into these fields to do this work are working really hard and doing amazing work. And they are, you know, I know that in my office, I bend myself into pretzels to figure out how to puzzle piece stuff together so that we can meet the majority of people's needs. And we know that we have a system that has, in Chittenden County particularly, has put school services clinicians and social workers in a lot of our schools to try and help, you know, kids go to school 5 days a week normally. But that's a place where they spend a lot of their time. And we've got some really innovative stuff happening right within our schools, because we know that that's a place where kids are going to be caught. And I'm going to let Christina talk more about what that looks like, because that's her day-to-day work. So that's one thing that I think is working really well. And I do know that we have, you know, through the Howard Center, we have our street outreach team that is really trying to connect with people who don't have houses. And one thing that I think actually went really well when COVID hit is we worked really hard to think innovatively about how we were going to get people who were living on the streets to safe housing. And I think we have a real opportunity right now to figure out, how do we keep them in safe housing? Like, why would we let people go back to living on the streets? I think we have, you know, as Gabe was pointing to, an opportunity in this moment to end homelessness in Vermont. It's going to be some investment up front, but what you're also pointing to is that saves money over time, because it prevents the crises, it prevents the chronic illnesses that come with homelessness, and the trips in and out of hospital that come with homelessness, and time spent potentially in engaging with our criminal justice system. And those things are places where we not only do we save the damage done to the people that are experiencing that, but we save money. And so I think that it's a wise investment, both from a human standpoint and also from an economic standpoint. So I think that and the other thing we really saw with COVID, I can speak to my own community, is that our communities really do care. And they, you know, so I think that when we are able to come together, I wish it didn't take a crisis of this magnitude, but when we come together, we really actually can do some pretty amazing things. I did some work in Essex organizing a mutual aid project, trying to connect neighbors who had more than they needed to neighbors who didn't have what they needed. And the outpouring of volunteers and donations, and it's still continuing. You know, this isn't over. It's certainly not where we were in March, but it's still continuing. You know, I just got an email the other day saying, hey, you know, I've been supporting this person and it looks like they might need something, you know, something else. I'm happy to keep doing it until you find someone. So I think that those are some pieces that we really do have that are going really well in terms of the people that are doing this work and the way we've already gotten innovative. You know, the support line was really also speaking to that. It was, how do we capture people and give them the support that they need to prevent crisis, to give them space to just talk and to vent. And I mean, that is a free service that is open 24 hours a day, 7 days a week for any Vermonter to call and just be provided anonymous support. And so we do have some really cool and innovative stuff. And I've found in my time as an adult in Vermont that Vermonters are often willing to think outside the box and to be creative. Some of the things I think that we need to really work on in terms of just how do we support more people? I think that in our current medical funding model of a fee-for-service insurance coverage, we need to fight for interpretation to be covered by insurance. You know, and that I think will in some ways open the door for people to get more equitable access. We need to think about within our education system, how are we lifting up people of color and people from other cultures to go into these fields in the first place? I was looking for someone who specifically wanted a Black female clinician, and I could find one in the entire state. That's a problem. And that doesn't necessarily mean that that's the only one that exists, but it's the only one that through my massive searching that I could find. And I know that white women are overrepresented in these fields. And I think we need to think outside the box. In my practice, I actually am taking younger kids because we can go for walks in the woods and we don't have to be in my office. And I've always offered that outside the box work, partly because I don't, you know, I work with teenagers, and sitting on a couch facing each other trying to talk about things doesn't often work very well. And so I regularly would be like, all right, let's leave. And they're like, wait, what? I'm like, let's leave. We're going to go for a walk in the woods. We're going to take the dog for a walk. We're going to do some art therapy. Let's listen to your favorite song, and like just really trying to make those connections in outside the box ways. And I think we need to broaden and expand our support systems to not just be what we've always done, but to really incorporate a wide range of choices for people. The other thing that I see a lot that we really need to do better is just the lack of in-state options for youth care, particularly. I just had someone that I work with, you know, a teenager who needed inpatient care and had to leave the state to get it because we just don't have it. And so I think that we also need to really think about how we build up our in-state supports so that there aren't lengthy waiting lists and kids aren't having to leave their community, because the reality of it is those supports won't work because the environment won't change. They won't be able to do the intensive family work needed to really be able to come back to a healthier family. They can do a lot of work, but when we're asking parents working 2 or 3 jobs to drive 3 hours to Brattleboro or drive to New York or Massachusetts to visit their kids, they can't. And so I think there's definitely a lot of stuff that we need to build out. So the capacity, certainly there's a lot of work to do, but there are things that are working. I hope that answered all those questions. It was a long list.
I'm wondering what other panelists think about the issue, how you see the issue of capacity.
Yeah, so I can chime in here to kind of like echo what Tanya said and to build on to what she already said. I think we talk about, you know, whether or not we have services, right? Whether or not they are present. The fact that she can only find one Black female clinician is shocking, but I'm not actually shocked because I know that Howard Center had an opening for a bilingual Nepali speaking licensed clinical social worker, and it is still open. It's been like 8 months or 9 months, and they are not able to fill that box, right? They're not able to find anybody who can speak Nepali and English. And since I am a native Nepali speaking individual, I looked into it for the qualification and whatnot. And the Bhutanese Nepali refugees started coming to US in 2012. So if they were to start their schooling right like 2012, it has only been 8 years. So it's less likely that they're going to find anybody with those qualifications. So what are we going to do with that? We know there is a need, but what is the next step? Like, how can we make sure that there are people who are supporting those who are in need, but at the same time, we are creating this pathway for people to build on their career because we need these people, right? So that's one of the things. But again, the interpretation, right? And one thing that I also wanted to say is like, simply because they exist doesn't mean that they are accessible, right? That's the biggest piece. Like, it should be the question of whether or not they're accessible and whether or not our public, our community can actually access this service, right? There is a lot of services that are out there, but we cannot access because of high cost, because our insurance cannot cover it, because of this long list, right? And one of the things that I think is really working well based on my knowledge of this small group of community, like especially former refugee and immigrant population living in Burlington, Winooski, and Essex area. What is working is simply providing a space where they can be themselves. And it is as simple as that. And it works with youth as well, because I have worked with youth ever since I came to US, right? All they want to do is talk, right? All they want to do is to have somebody who can listen to them, who can listen to them authentically, right? And I always implement one of the strategy. It's called SAFE strategy, right? SAFE, that's share your story, right? Share your story, share your ups, share your down, share anything in between. Don't just talk about successes, because it's going to put pressure on your youth and also adults who are actually struggling. Share your failure. Be as authentic as you can. Share your failures as well. Talk to those people about how you overcame all those failures, how you overcame the challenges, so they know what to do when they are actually going through the same phase, right? S is for share. Action. Action should be always based on hope, right? You should be hopeful that they can overcome. You should be hopeful that simply because we care about them, simply because they are willing to talk to you, means they trust you. And hope, you need to hope, like you need to, do something that's going to impart, or that's going to actually implant hope in your client and our youths as well. Have faith in them. We are capable. Again, like this is one of my favorite lines to say, we are capable of doing what we want to. We can be it, but we don't know whether or not we will have enough resources or support. And that's why we come in, right? Providing the support with the faith that they can overcome the challenges. Is express, be authentic about your feeling. When I was working with youth in the teen program, I said one sentence that completely changed the way I looked at youth. When I was talking to him, there was like behavioral challenges. I pulled him in the office and I said, I had really good relationship. I have to say that. I had a really good relationship with this youth. And all I said was like, you know what? I'm disappointed. I'm disappointed at what you did. I'm not disappointed at you. I'm disappointed by your behavior. I know you can be better. I know I have seen you in a better side, and I know you can be that person again. And all of a sudden, he said something that changed my whole life. That is, he said something about, I disappoint myself sometimes. It is those conversations, right? They realize it, but they want them to be respected. And then I continued my conversation saying, I respect you as a human being. That means I want you to be as responsible as a human being, as an adult. I respect you. And those words, respecting them, help recognize how much they mean to me, right? So doing those things. And the other thing is like, I think connecting culture, which is at the UVM, Connecting Culture actually organized like online Zumba or online yoga classes for Somali women. So having space where people with shared like similar lived experiences can talk about their struggles, talk about those things. Because again, like, we don't need solution to all the problem. All we need is somebody to talk us through those challenges, right? And we human beings are so good at manipulating the meaning of everything. We term challenges as problems, so we don't have to face them. These are simply the challenges, and we can overcome these challenges, right? So having faith in those things. One thing that I have seen work really well is actually like all the social workers that are working in the school district. I really have to applaud them for what they have been doing and what they do out in the community, right? Going up and beyond to meet the need of kids with diverse background, not just in terms of race and ethnicity, but lived experiences, people living in the shelter, homeless shelter, and people with like all sorts of problems. They do an awful lot than what we actually recognize, right? So having some of those things, and last but not the least, and this is coming from the adverse childhood experiences research, having a responsible adult, good relationship with responsible adult helps youth to face all the challenges, not only in the future, but also help to mitigate the adverse experiences that they, faced when they were a child. So if we can be this person who the youth can trust us with, just be there for them in the time of need, I think we can change the whole landscape.
Umesh, I'm sorry to interrupt. What is the E?
Oh, is express your emotions, express how you're feeling, right? Be authentic. You don't have to hide your feeling. We are all human beings, and that's gonna actually, make you human. And if you can be a human in front of youth or a child, I think that's one of the things that we can all do, and that's going to change the life of another child because they can see human in themselves.
Gabe and Christina, do you want to add to that discussion about capacity and
Yeah,
before
absolutely.
we get into our question and answers from?
Yeah. So first, before I get into that, Umesh, I love how you're talking about differentiating between the behavior and the person. Saying I'm disappointed in this thing that happened rather than in you, and that's something I talk with parents about all the time. And you also mentioned ACEs, adverse childhood experiences. This is just sort of an aside, but I think we're all pretty familiar with what that's about. But I think that I haven't really heard talk about this, but I wouldn't be surprised if the experience of COVID is counted as a new ACE. If they will add that, going through a pandemic, I think that it should be on that list. So speaking to capacity, yeah, I agree with what everybody else has said so far. I think the quality of the work that's done in the community is excellent. But I do think that there is a shortage on quantity. I think that there have been so many times that I've heard from parents and teachers, and I've also had the experience myself of where I'm seeking out a resource for a child or for a family. And there are great workers in the community, but it's just not available when we need it. And people are either, if it's a crisis situation and we need somebody there now, that sometimes that can't happen. And we wind up waiting for hours and hours or sometimes the next day. And then that kind of, in that frame of time, other things unfold and the problem becomes much more complex. And similarly with waitlists for programs, if a family is, sometimes there's just a small window of when someone's like, a family's available and able to seek out a certain type of support. And then if they're sitting on a wait list for 8 months, in 8 months from now, their situation can be totally different, and then they might not be in the place anymore to be able to accept the service. Maybe their hours changed at work, or someone's no longer living in the home, or something's just completely different. So we need to work on being able to meet the needs in our community in a more timely manner, and in a way that makes sense for families, and giving them what they ask when they're asking for it, and not saying, well, sit in this bed in the ER for 3 days until we can find you a bed. And also with what Tanya said, I want to speak to that as well about just the services for youth, and not just for youth, for adults as well. And maybe Gabe might have more to add about this, but I think that there's a lack of, I don't want to use the word resources, just a lack of places for people to go, a lack of higher level of care when people do need that. We don't have a whole lot of options for kids if they are in need of that higher level of care. And I've seen similar things with adults as well. Wait lists for beds are months and months long, and in the meantime, where do they go? And Tanya spoke to a student having to go out of state for care. I've definitely seen that happen before too. And then there's also sometimes an overlap with DCF getting involved in situations like that. For certain facilities, they won't accept a child unless they're in state custody. And sometimes I've come across scenarios where, I don't personally feel that that's necessary. They're not at a level that anyone's being abused or neglected, but they might need access to a higher level of care, and then they can't get it unless they come into custody, and then that creates all sorts of other conflict for a family. So I think we also need to do a better job of communicating between groups, between DCF, between mental health, between schools, to understand, what exactly we're asking a family to do before we ask them to do it.
Thanks a lot. You'll have opportunities to respond to different questions. I want to make sure that Gabe has a chance to respond to that before we then kind of open it up to folks' questions. And I would ask folks to post questions in the chat if you'd like to do it that way, or you can just raise your hand and let us know you want to ask a question.
I do
But
think
only after Gabe.
I think in terms of substance use treatment, there is a lack of a high level of care. So the hospital can detox somebody, but that's usually a very short time frame that happens. If somebody's coming in with more complex medical issues, we usually refer them to the Brattleboro Retreat, and that is the only place besides the hospital that we refer somebody with substance use issues that needs a higher level of care. So I think that's a problem, that's the only place we refer to in the whole state. There's a lot that's been said here. I think I did say the services were working, and I think that's true. I think what Umesh and Tanya were talking about in terms of access and who has easy access to those services in terms of different languages, different cultures, things like that, that needs to improve a great deal. The agency I work for is currently wondering why, A, their staff is not more diverse, B, why their clientele is not more diverse. And they did like a culture and climate survey, and now we're actually like tracking data at my work, which I understand is necessary. I also think it's intrusive and can add stress to an already stressful situation. So I hope that my agency is going to be able to take that data and do something useful with it rather than just collecting data just to have in a database. That seems to me kind of like eugenics. But so yeah, I think who is welcome, who feels welcome, and who can practically get good care based on cultural differences and linguistic differences is huge. I think just real quick to go back to the systemic piece of things, addiction rates go up for people who live in poverty. Addiction rates go up in countries and areas that have a weak middle class and job insecurity and a lack of social mobility. For addiction to occur, somebody has to be vulnerable to addiction, and somebody has to be under stress. And so there's so many things in our society that add more stress in terms of trauma. It's like, what can we do on a legislative level? So I think the relationships we form in the first 5 years of our life especially are so important. So in terms of that vulnerability to addiction, if trauma is making people vulnerable, and I think that is one huge piece of it, so many people I see are survivors of domestic violence, survivors of sexual assault and abuse. So legislatively, where is our paid family leave and our quality early education and childcare systems so that these kids can be in a safe environment, having loving relationships and good connections, will just pay itself forward for generations in terms of like, so that people don't perpetuate those things that we've been talking about that get passed down through the generations. But I don't want to take up any more time, so that's it for me for now.
Well, wow. Okay. I've been taking notes rapidly. Why don't we open things up to the folks who have joined us to, what questions do you have or comments you'd like to make based on what you've heard so far? Some of you work in this field and may have your own perspectives.
And if no one raises their hand, we have questions.
All right, well, we'll jump in. Oh,
Amy.
do you have a question?
And Trina.
I'll ask a question. I don't work in this field and don't really have much experience. I would say thank you all for doing this work. It's very important and sounds like difficult work to do, so I appreciate it. The question I was going to ask was just people have talked about COVID a bit, but also given that the winter is coming and that'll cause even more social isolation and probably put more pressure and stress on people. I was wondering if folks could just talk to that and I don't know what people can do when it gets cold outside and you can't go for a walk and talk with a friend, and how that'll impact the community's mental health.
Jamie, I can chime in because I'm a big hiker, but I don't know how to have fun with snow. And the fact that I was not born here in Vermont makes everything much harder because, again, like, you know, I'm a hiker, I go out to bike, but in the summer I have two options: either to be depressed and stay at home or pretend that I'm enjoying this snow. I mean, I'm saying pretend because I need to pretend that I'm enjoying this snow. So I think one of the things, as soon as the COVID hit, we took on the big responsibility. Our organization took on a big responsibility of making sure that we are reaching out to the youth throughout the whole state, right? And then we immediately recognized that the affinity group where they felt like they belong, right? The affinity group in their schools were no longer operating. So we started creating like virtual room or virtual space for them where they can talk about their issues, where they feel like youth voice matters, right? Where they feel like there is somebody who they can talk to. Even though they were adult, it was basically time for them to talk to each other and have, solve problems that each other are facing. Because the fact that we are here, and I heard 3 other people speak here, I learned so much. And the fact that we will be able to provide that kind of space for youth to talk about their challenges, they will gain something by listening to somebody else. So maybe being creative and finding ways of I don't know what it would look like, but finding ways to organize some kind of virtual cafe or whatnot, maybe on a specific topics based on their interest. Because youth now, they are they know what's happening around the world and they want to contribute to the well-being of this world as well. So they are based on their issues as well. A bunch of youths want to be a part of climate change, activists, right? We can have a virtual cafe for those youth who are really motivated and who want to do something about it. There are youths who want to talk about sports. Let's have a talk about sports in a virtual room, right? So having some places where they can be themselves and talk about the issues that matter to them and the issues that they find joy in.
I can also, this is something that I'm talking about with kids and families and young adults across the settings that I work in to try to plan forward. I know one of the things as things started to shut down, I remember saying, back in March is, at least we're headed into spring and summer. It'll allow people to be outside and not be, trapped in their homes. And winter is hard in the best of circumstances. And we're not there right now. We're not in the best of circumstances. And so I've been really trying to work with people to connect to the things that they're passionate about and find ways to make those connections and do exactly what you're talking about, Umesh, is really find the ways to plug in spite of how physically disconnected we are. I find myself, and I know it's just a language change, but sometimes, not so much talking about being socially distant, but we're physically distant. We need to stay socially connected and really trying to creatively think about how we create that. And, going into winter, it's been at least a month that I've been connecting with kids, with young adults, with parents about what's the plan? What's the plan going to be for winter? We don't really know what it's going to look like. And we know winter is always really hard for many. And this might be harder. So, I have been, and it's across the board, encouraging kids who are really motivated to try something they've always wanted to try, or to visit that virtual museum with a friend or virtually, but really just trying to find ways for people to hold those connections. The other thing that I can't say enough, and this might seem silly and mundane, is that everyone should be taking vitamin D. The side effects of vitamin D deficiency look like exhaustion, sadness, they look like depression. And I'm not going to tell you that vitamin D is going to solve everything, but the CDC recommends that anyone at our latitude be taking a vitamin D supplement from October to May, because the sun never comes out. And that's how we make our vitamin D, is by our skin capturing sunlight. And so that's one little thing that I can give to people just right away, go start a vitamin D supplement. But also, maybe you do want to learn how to knit this winter. Is there a way we can connect you with someone who already knits? Or maybe you do really want to find out if you love watercolor or learn how to cook, but finding things that make us feel engaged and like we're learning. My experience is that the most effective ways of healing are when we engage our mind and our body and get ourselves fully present in the here and now, and learning and connecting are really great ways to do that.
And I would just add one sentence when talking about learning. I think learning new language is a great thing to do, even when you are at home watching this screen. Learning a new language, that helps, not only for you to communicate with people like my mom who doesn't speak English, right? But also it helps you in building this connection in the brain, like cross-hemispheric connection, and it helps you process things really faster, because science has proven that just by learning a new language, you can change the whole wiring of your brain. So learning new language for youth is going to be really helpful as well.
Trina, did you have a question? Oh, I can't hear you. I think you're muted. There you go.
Okay, thank you. Well, I'm now a retired lawyer. I was a lawyer working in child protection for many, many, many years. And the families that have the most needs and end up with in DCF, either custody or working with DCF, feel judged all the time. And they don't feel that the system has any supports for them. So I urge you all to find systemic ways for the families who are all poor. They will look at you cross-eyed if you suggest that they learn how to knit, because they don't have any resilience anymore left in them to do things like that. And so how do we create systems for supports, and not just judging them and telling them what they need to do, but actually support them? And Umesh was talking about how we start talking with people in different ways so they don't feel judged. I think that's, and we know that we can do it because we have seen situations in which it really works. And once the families feel connected and not judged, but supported, they can do such good things. We just got to find a way to do that.
It's a good segue, Trina, because you were talking about systems, to Sue's question. Sue, do you just want to ask it rather than my reading it?
I'm sure. I was actually answering Caroline's question in the chat about Woodside, but I'll leave that for now. So I am curious about, and I pose this question to our potential representatives around systemic issues in our mental health services. And so I'm very concerned about the way mental health services has gone in the last 10 years. We talked a lot about children and families. Back in 2009, we had 256 beds available within the state of Vermont for kids, for mental health, for some form of mental health or child protection, not including foster care. We have less than 100 beds available within state now. That was a very intentional decision to reduce the number of residential programs, but the community, the available resources for communities did not keep pace. So we took money away from residential programming. We didn't put it back into community services. The same thing is true for substance use. We took money away from residential placements, but we didn't reinvest it back into the community. So I guess my question really is, what's the way through this? We have historically funded mental health services in two ways: grants which are not sustainable, and fee for service. So if I come out to your house and I see you, I then bill your insurance, whether it's third party or some kind of some form of Medicaid or Medicare. I really hope that we are moving toward the idea that mental health services, especially crisis mental health services, should be considered essential emergency services. I don't call the fire department and ask them to come and put my house out if it's on fire and then have them show up and say, well, what's your insurance? They come and they put out the fire. That really is what's happening for our communities. I think it's 1,000 times worse for people of color. And we just really seem unable to address those issues. So I guess the long answer to a very short question is, what do we do? What are some of the ways that we think need to be addressed systemically in order for our mental health system to really keep up with capacity and funding and keeping kids out of custody and providing access to immediate treatment services for folks who are struggling with addiction? Sorry, very long question.
Oh, no, I mean, we keep this to an hour, and people should feel fine about tuning off. If you would like to stay longer, the panelists have said that they would be willing to stay a little bit longer to continue the conversation. And it is already 6:57, so I just wanted to be, I wanted us to be aware of that, but hint that we have a little flexibility in terms of our time. So who wants to take that on? The systems issue.
Well, go ahead, Tanya.
Go ahead. Go ahead, Gabrielle.
I was just going to say, I think this is a critical question. I mean, we keep talking about where is the money? And the question is, how are we using our money? I mean, I'm an expert in climate, energy issues, and we spend $1.5 billion just sending it out of Vermont on fossil fuels for heating and transportation issues. A similar question could be asked about law enforcement. You're right. We have taken away the support for our social services, and we've asked more of our law enforcement, and they are trained in a different way. And now we come to this head that is that needs to be addressed. It needs to be reckoned with. It does not mean we do not have the dollars. It means we can rethink how we use them. Same with criminal justice reform, and this is, right in Tiff's bailiwick in terms of all that she's done, in terms of why we keep more people in jail rather than helping them to, open their potential and harness the life that they imagine for themselves. I think there's a lot about why and how we use our dollars that we have set aside, and how and why we can use our dollars moving forward. My question, I mean, I don't think that really answers your question, Suzanne, except for the fact that I definitely plan on looking at where we put our money and how we use it. And Gabe, I appreciate your comment on data and metrics, but I'm someone who wants to see what are we getting for those dollars that we're spending, not necessarily in terms of who we're serving in the mental health community, but if we're spending, millions of dollars in one area, are we really reaping those benefits? And could we reap them in a better way by perhaps looking to other states, other countries, or just being Vermont creative in terms of, how we go about things? I had a question, which is the capacity. I mean, if we had the money, is it like, if we build it, they will come? Is it like that in terms of capacity? And I ask this to you four panelists, does it work that way? Because I grew up, I mean, my mom's a mental health practitioner, and I grew up in the Boston area. There was plenty. I mean, we might drive through 2 hours of traffic and go 15 miles, but there was plenty of resources. So does it, how do you get the capacity? How do you bring people here to provide these critical support services so that we address the issue before it becomes a crisis that evolves into a different category?
So for me, that's really where the answer lies, is in that investment in prevention. And that doesn't mean we're never going to have a crisis. But what I've seen in my work is that when we're able to intervene sooner, we get less of that. You know, it's so frequently what I run into is individuals who have struggled in multiple areas of their life and just continuously butt up against not getting their needs met. And eventually that leads to crisis, whether that leads to crisis because people have learned that's the only way to ask for the help that they need because they're not getting it when they're saying, hey, I need help, or because they just don't have anything left to give. And the reality of it is we have seen a divestment in these types of supports since at least the 60s, when we deinstitutionalized and didn't put any of the money into the community supports that were meant to prevent people from needing institutionalization in the first place. And I'm not saying that those institutions were okay, they weren't. But we took those away and didn't provide any supports. And we're doing that again. And we have divested from education, and we are divesting money from the things that would give people what they need and would prevent the need for a lot of these crisis services. And we're closing stuff down without providing the adequate community supports that we need. And we need it. We need to invest in universal health care. And then all of a sudden we don't have the question of, well, do you have insurance? Sorry, I don't take your insurance. Or, you know, I work in my office and we'll fee for like sliding scale. You can afford $5. Great. I'll do it for $5, but that ultimately means I'm not getting paid and not able to keep the lights on. And so the reality of it is the system isn't really working in that sense for anyone. And we need to invest in livable wages. That is mental health care. We need to invest, as Gabe said, in paid family leave and early education. That is mental health care. And intensive outpatient programs and community services. And do we need those higher level services? Absolutely. But I strongly believe that if we move money into prevention, we will need less of those services, but we can't do one without the other. And so frequently what I see happen at the legislative level is we do one piece, but we don't do the other piece. And then we end up with these expensive messes. And lives are lost and ruined. And I think that we can do better. And we have like these little pockets of these amazing programs. There's a 2-bed hospital diversion program in Rochester, Vermont. It's called Alyssum. People can go, they can be however they want to be. They're provided, they don't need insurance. It's a free service. It's funded by the state. And they can hang with the chickens, and they're provided meals, and they can cook with the individuals they are meant to support them, but they get to show up as they are and just be provided safe support. And this is a means of diverting people from higher level care. And so do I think that we're going to live in a world where we don't need crisis supports? Absolutely not. And we need to fund those. As Sue said, when you have a crisis, you call and you say, I'm in crisis, and someone says, how can I help? Rather than, what's your insurance? Please wait 2 days until we can get someone to you. But we also need to make the investments in the preventive supports that meet people's needs so that they can not be chronically stressed because they have 3 kids that can't access childcare because of their behavioral issues, and they're working 3 jobs and their partners. Like, we have to put the work in so that those aren't people's realities in the first place.
Yep. And talking about like preventive measures and whatnot, I think I was reading an article about, I think it's in Denver. I think I'm like 99% sure it's in Denver. Like, when you call 911, instead of police showing up, like if somebody calls 911 saying there is somebody walking on the street or like trespassing somebody else's private property, the mental health services provider or the mental health professional will show up, because they said something that really stuck with me was like, they need help for themselves more than the safety of others. Like, they are actually causing harm to themselves. So having some kind of system in place where when you call something, you know, if it's not like, you know, if somebody is not hurting somebody physically, or even if they are, like, there be the presence of one of the mental health services professional to respond in our 911 call will be one of the best way to go to kind of like destigmatize the mental health services, and also the our system, right? Criminal law system and all the, you know, talking about all those things. And I think our system, if I had to be honest and blunt about it, I think our system represents the legacy of reinforced inequalities. And until and unless we work together to kind of like end this historic struggle for the future, then we will not be able to solve all this problem. It definitely takes a step, but like reaching out to people who doesn't look like you or who have difference in the opinion, right? Because they will have something to contribute towards your discussion. And regardless of whether or not you agree with them, you will learn from them. And if there is one thing that you can take from the conversation of 1 hour, that's going to improve our mental health services for our community, I think that's a progress, right? So reaching out to people who do not look like us, who do not have the same opinion, but learn from them. We can learn from the failures as well. So learning from their failures so we do not repeat those things in our system will be a better idea. And having people like us, having all of us, like look at this room, us testify or talk to our legislator, talk to elected official about the need and inspire somebody who we know to talk to them. I think that's the best way to go with this kind of issues.
A couple other direct investments that I think we need to invest in to solve some of the challenges that Sue is pointing to and that really we're all pointing to is I think we need to invest in harm reduction and different options for people who are struggling with substance use. Currently, we have kind of a one-size-fits-all model, and the reality of it is one size, in fact, does not fit all. And I think we need to work towards decriminalization of non-violent drug offenses so that people don't have to interact with the criminal justice system. Our criminal justice system is deeply flawed, as I'm sure everyone here knows. And if we can prevent people, give people treatment rather than entering them into that system, I think that we can do a lot of harm reduction and cost saving work that can then be invested in other places. And I also think we need to invest in restorative justice. Again, the more I think we can keep people out of the criminal justice system and given the tools to heal and to be engaged in their community, the better we will be. I mean, we live in a highly traumatized, this Western world that we live in is a highly reactive and highly traumatized society. And I think we need to really think about coming together, as Umesh said, really coming together and realizing that as people, we all have more in common than we do not. And our struggle is a shared struggle and that we together can heal that in really innovative ways. But if we stay in this space of like, no, it's your fault or no, it's your fault, I just don't, I think we'll kind of keep down this path that we're going down. And so I have a lot of faith, again, just because we're here in this space together, that we can really come together and bring, Gabrielle, your work in climate justice, because that's mental health care, in making sure that people aren't, sitting with existential dread that the planet is melting. And Tiff, I know your work is mental health care, but I think that coming together with these unique perspectives, we're actually able to create something that no one of us could have built alone.
I want to, I think that, so Sue, I don't think we talked about aspects of the issue that you raised. And it makes me want to have a whole conversation just about the systems issues, because I just had a conversation with somebody who used to be the AHS secretary, who believes that the system is deeply flawed. No, its various pieces don't talk to one another, and that is a place where, beyond what you're talking about in terms of investments, that's a place where I think the legislature might be able to help. But I think that we need to talk about that more. I'm wondering if our panelists, if there are any kind of last words that you want to offer to us. Those of us who hope to be in the legislature, or those of us who are in the field of social work, and that seems to be pretty much everybody who is left in the room right now.
Well, I think I do have to work overnight tonight, so I do have to be leaving. I think there was a lot here. Sometimes I wasn't as articulate as I wanted to be, so I will make the very generous offer that anybody that has my contact information and ever wants to reach out to me, with questions or a deeper explanation of some of the things I was talking about, or if somebody has an idea, they want to run it by me. Like, I'm going to be very isolated myself this winter, except for work. So I welcome people to use that email address. And that goes for people that were watching this panel and everybody that was on the panel. So.
Any other last words from anybody?
Yeah, so I think, have good intention, but intention is not always enough, because, in a society where we are all traumatized by our institutes and people who look different than us, evaluate the impact of your work as a legislator. Having good intention is a good start, but make sure that you have courage to evaluate the impact of your work as well. And if there is any flaw, don't hesitate to just admit it, because it's only going to make you human. We are all human, and everybody understands that. So that's my last word, I guess.
Hi, everybody. Is it okay if I go ahead and talk? Can everybody hear me? My name is Jan Coleman, and I am a psychologist, and I work in the schools in local schools in Burlington, and I'm fully aware of everything that everybody has talked about today. And thank you for kind of bringing this panel to life. I think somebody mentioned Vermont creative, and that word stuck with me. And if we are creative, we can, I don't want to say solve some of the problems, but definitely make a good headway into it. And I really firmly believe that part of that is to work with the children and the adolescents in our communities. If we can, in the work that I do, which is direct service work, direct therapy work within the schools, kids spend all of their time. They are there from 8, well, in a non-COVID style, but they're now going back 4 days. They are there 8 to sometimes 5:30. That's breakfast to dinner, right? And so really figuring out how to directly fund mental health appropriately within the schools is, I think, paramount to the preventative work that people have been talking about, and being creative in how we're doing it. I mean, it's a constant, I want to say, advocacy that I'm doing all the time, not only for the resources I need, such as office space to do the job, but also supplies and, just people too. So I guess that's the comment I had, is that Vermont Creative stuck with me, and how do we look at this model that we currently have, which is really not working, in a different way and in a more of a creative way. So I'm happy to have conversations with anybody. I have worked with Christina a lot in the past, and she has my contact information, but you can also get it. I think I registered here. So happy to have conversations with people, and love the energy that I heard tonight. So thank you.
Thank you.
I do want to say, Tiff and I have gone back and forth on how long these should be. And I kept saying 1 hour, because otherwise people won't sign up. And the reality is, every topic we've picked, and this topic in particular, is you cannot cover it in 1 hour, as we know. And so we hope this is just the beginning. And I'll leave it at that.
Yeah,
I just want to thank you, Tiff and Gabrielle, for helping to bring us together, and to all of our panelists for bringing their voice and bringing their experience, and just being willing to take part in this. We know that in an hour, we're not going to solve all of the challenges, but I think this is a start, and it opens the door to those generative conversations, because I know that we need these to continue. And particularly, I'll speak for myself, and I imagine, having talked to Tiff and Gabrielle, that this is true for you as well. You know, if I am in that office, I want to continue these conversations, and I want to do exactly what you said, Umesh, make sure that the people who are most impacted by this are the people that are centered in how we solve these issues, and the people whose voice is heard at the table and who get to tell us how we can better meet their needs. And I can speak from what I'm seeing, and I can speak from my own experience of having grown up in Vermont as in a single parent working class home where we actually didn't have everything we needed all the time. And but that's just my experience. And so I think that, again, bringing those voices to the table is really just cornerstone to what I want to do. And I just want to thank you for the opportunity to do that a little bit here tonight.
Yeah, well, and you pulled this panel together, and I really appreciate all that you said. I learned a lot, and as Gabrielle said, I learned that really maybe we should have at least made this an hour and 15 minutes. But anyway, thanks very much, and we'll follow up with an email and a little questionnaire, very brief questionnaire after this. So thank you
everybody so much.
Take care, Gabe. Good luck tonight.